these are fundamental and very basic services that the state must offer. And what the new health policy says is that these must be assured. And it promises to work with the provinces to make these basic services available. And I believe that if we can achieve this, and can I tell you that one of the big challenges that the leadership is going to have is to try and convince the planning and the finance divisions to be able to sail with this message. And if you can combine this with another initiative which is on the table, which is a health insurance or a health subsidy for those poor who are identified in the Benazir Income Support Fund. Those poor have, the targeting of them has started along the lines of a poverty scorecard, and the aim is to get to 16 districts by the end of next year, and behind the development of the scoring system and the identification of the poor will come the Benazir Income Support Program, but plus a health expenditure and livelihood protection program with the acronym, but nobody's buying it in Islamabad right now, which is HELP. And I believe that what the HELP program does is that it does protect those people who are forced to seek admission to a public or a private facility, but even if it is a public facility, they are asked to spend money on services, largely supplies, and this is a burden which really is intolerable. And I think that this combination of this subsidy for admissions and the basic set of preventive services should bring us, at least conceptually, and then I hope in time, in reality, closer to the vision of health for all vulnerable people. The biggest problem in this, and Dr. Sanya and her work does address this, is the issue of human resource. The biggest problem in Pakistan, I think, is not that medicines are stolen and that there's pilferage. We can live with that. But what we can't live with the lack of the human resource to deliver health. Because at the end of the day, health is a service that is delivered by humans who are trained in certain ways, are trained along certain parameters, and the whole force or cadre of health workers that are required, appropriately trained and appropriately motivated, is what you don't have. And what's sad is increasingly they're turning their backs on the public health system. And for me, that is the biggest challenge. The biggest challenge is how do we, perhaps by a combination of things, a lot of it will involve task shifting tasks of physicians to non-physicians, but how do we get people to go to remote districts, remote union councils, and remote villages and provide these services? And those are the things that people like yourselves who've been here for 2 hours and I see deeply interested in the issue of health. People like yourselves must come together and share ideas, and more important, once again, bring to center stage the motivation that the health workers require to do this. I want to just end by saying that having spent some time in Islamabad, I realized that the biggest challenge that Pakistan faces is that there is no coherence of authority and power. Every person in Pakistan is a big shot. And it's a question of how big shot that big shot is, or how big shot the man that you believe is your patron savior can be when you need him. At every flow of authority, there is distraction and disturbance by extraneous influence, because authority doesn't flow in the way that it should. I want to just share with you something that Tipu alluded to, and a lot of people believe, which is there is perhaps corruption and maladministration and malgovernance in the way medicines are registered. And indeed, the author in her book refers to this as well. If there's one direct responsibility that I have in Islamabad, is to register medicines. And when I got there, I realized that for a long time, my predecessor had stopped really paying attention to this, because her patron was the ex-military dictator. The military dictator had gone and she had lost interest, and she stopped having registration meetings. And there was a huge backlog. To me, this backlog was obviously a honeypot to draw people to pay to jump the queue. And I said to this section, we are going to finish all pendency. I want you to work overtime. I want you to put up all the files. I want you to draw big agenda items for our registration meetings. And we started. And in the first month we held a meeting, the second month we held 2 meetings, and pretty soon the industry was applauding and saying this is great. But then there came one particular meeting where there was a large number of items that were being imported from around the world. And the industry said, but how can you do this, because we make these items? And we said, yes, but under the free trade agreements and the WTO rules that the government of Pakistan has ascribed to, you cannot ban these or you cannot restrict these unless you do them by certain well-defined quality parameters. But they were having none of this. And pretty soon, it was all over the press that the registration board had done 4,000 drugs in one meeting, not saying that in the previous meeting we had done 4,500, and in the previous meeting before that we had done 3,000, and they were loving every minute of it. And what made this whole issue worse was that amongst the drug industry owners who would like to see a monopoly of general products, let's say, which is what they make, amongst the factory owners were also people sitting in the assembly. So pretty soon we were dragged before the Standing Committee of Health of the Assembly, and we were dragged before the Standing Committee in the Senate, trying to justify what we thought we were doing in the best interest of the industry. Nobody could point out to what we had done wrong or what rule we had violated. It was all innuendo. That they've done 4,000 drugs, and there's a particular program which I don't know about, but I heard that that was having field day, where they sit and talk about corruption in government. They said 4,000 drugs, DG, and this, I think, of course, was patently unfair, but it's an illustration of how special interest groups conspire to bend things their own way. And now what's happening, of course, is that we're saying, hey, we can't do more than 500 or 1,000 drugs in one meeting. And they're saying, but the industry is dying. But I said, but when we were doing everything that we could for you, you were saying there's something wrong. So there is this situation where regulatory authority and regulatory efficiency is constantly challenged. And that's the point I wanted to make to you. Because if you do read Sanya's book, and I have read it, the one thing there's one phrase that keeps coming up over and over again, perhaps once every 2 or 3 pages, and that is weakness of regulatory regimes. And I suggest to you that regulatory regimes are challenged because of the fact that the flow of power and authority in Pakistan is contaminated at every level by political forces that should be working in the interest of the people, but are devoting all their energies in working in the interest of themselves. Thank you.
Juma for many clarifications. I have two quick confessions to make. Inviting and getting the minister's acceptance was not a very difficult task. He has, like many of us here, great admiration for the author. So he agreed to come and he said, I would like to because it's a matter of interest. And the second confession is because of our very old family friendship. I was privy to the information that you were sitting with the minister when I was talking to him. Choke pipes is well past wake-up call. Countries within the region have shown marked improvement in health indicators since they signed the Millennium Development Goals. There's no reason why we cannot. I will just conclude with a verse from Shakespeare before inviting Dr. Sania Nishtar to conclude the proceedings. Purity of heart, the peace above all earthly dignities, a still and quiet conscience. Ladies and gentlemen, I'd like to invite Dr. Sania Nishtar to share her views and reminiscence of the journey that she undertook to write Choke Pipes, and she will respond to the questions that she has received in the meantime.
DG Professor Juma, I'm extremely grateful to you for making this trip at the last minute. Dr. Ishaq Hussain, Dr. Binay, Mr. Javed Jawad, Professor Tiku, and my dear friend Amina, who now runs my life. Thank you so much for that. I have been so overwhelmed by the hospitality and by the warmth and by the welcome that I received in Karachi at the book launch. It exceeds the welcome, and I'm sure Amina will bear me out on that. It exceeds the welcome that we had in our own city, Islamabad. Thank you very much for that. I don't have prepared notes. I don't have a prepared speech. I was hoping to get enough questions to be able to weave into a coherent response, and I have received very few. My sense is that the panelists have done such an excellent job of responding to all your questions that you may have in your mind that there really is no need to dilate further upon the book. But I would nevertheless like to make some remarks. With regard to what the book is about, a lot of people ask me as to what my motivation was. And I think the motivation stems from the context. The motivation comes from the environment that 170 million people live in. We live in very troubled times. We live in a country which has external and internal security threats. We live in a country which has extreme kinds of macroeconomic challenges. And we see that as opposed to this, the capability of the state, I don't want to say the government because I don't want to go ahead with regime bashing. This is a state phenomenon. This is a systemic phenomenon. This does not have to do with individuals or administrations. We notice that the capacity of the state to target welfare towards people has been extremely eroded. And the book actually takes this and frames the discussion within this context. And today, if you ask me just one thing about the book, I will tell you, it is not about the health sector. It mirrors us and it tells us how the state system functions. And perhaps it gives some insights about how we need to initialize our thinking and get further along in our planning towards reform of the state system. There are two things that I'm very acutely aware of as an author of this book and after having brought this process to completion. One of them relates to the fact that health is not about the health sector at all. When I go to Geneva and when I sit on the side of the international, on the international side, indeed one of the papers that I received from the audience basically critiques as to why I do not accept public appointments within my country and choose to work in the international environment, and I respect you for that question. When I sit on that side of the table and when I see our Minister and the Director General and the Secretary of Health being bashed for the bad indicators that the country has, I think to myself, it's not their fault.